Hi, Bob. I'm Lindsay. I'm one of the nurse practitioner students today. I understand you're here for a comprehensive physical exam.
Yep, that's right. Hi, nice to meet you.
Nice to meet you. So we'll start off with me. I'm washing my hands. I notice you do have a drape over your legs. Would you like a gown to cover up?
This is okay.
All right. So to start off, we're inspecting the skin. I see there's no lesions. Skin feels smooth, no bumps. And I'm looking in the back, and no lesions or masses, bumps or rashes that I can see. Bob, is it okay if I take a look at your hands and your nails? I notice his nails are smooth. Capillary refill is less than 2 seconds. No signs of clubbing. And the hair is thick, no thinning. The color is blonde. Now I'm going to check your scalp. If you can lower your head for me.
Okay.
I'm looking for flakes, dandruff, any signs of lice, rashes, no scaling or redness. Scalp is atraumatic. All right. Next, we will take a look at your jaw. Now, before we do that, I just want to palpate the rest of your head. Any pain?
No pain.
No touch, no masses. Locating the TMJ. Can you open and close for me? Perfect. Any pain?
No pain.
So no tenderness, no clicking or popping. And can you pop out your chin, left and right? Any pain?
No pain.
And again, no clicking or popping with that. Next, I am going to assess cranial nerve 5 and 7. Can you clench your teeth? Perfect. Puff out your cheeks. Awesome. And raise your eyebrows. Great. Relax. I'm going to have you close your eyes, and I want you to tell me if you feel a light touch or a sharp touch.
Light touch. Light touch.
Very good. Next, I want to take a look at your sinuses, palpate the frontal sinuses. Any tenderness?
No tenderness.
Any tenderness to your maxillary sinuses?
No.
Any discomfort right there?
No.
Any discomfort to your maxillary sinuses?
No.
And I'm not feeling any swelling. Again, it denies any tenderness. Next, we will check your vision with the Snellen chart. Now in the clinic, Bob here would be 6 feet away. So I'm going to have you look at this chart, cover your right eye, and read the smallest line.
LTFPH.
Wonderful. And I'll have you cover your other eye.
LTFPH.
Perfect. 20/20 vision. All right, next we're going to assess the visual confrontation. I'll have you look straight ahead to that wall of flowers, and I want you to tell me when you see my fingers wiggling.
Okay. No. 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 No.
Perfect. We will now look at your eyes more with the extraocular movements. So 2 tests. We'll start with having you stay still, your head still, and follow me with your eyes.
Okay.
All right. So I'll have you take a look to the flower wall again, and just follow me with my finger with your eyes.
Okay.
Very good. And I'm going to take a look at the corneal light reflex. I'm going to stand 2 feet away. And again, I can see the corneal light reflex. Nasal side, central. And same on this side, nasal, central. That confirms cranial nerve 3, 4, and 6 are intact. Next, I'm going to lower your eyelid, inspect the conjunctiva. Sorry, my hands are a little cold. Now I'm looking in and it's pink and moist with no swelling or exudates. I'm going to be looking at your pupils. I'll have you look straight ahead to the flowers for me. Now pupils are reactive, equal, they're round, equal in accommodation, reactive to light, Perla, and that is confirming cranial nerve 3 is intact. Looking at the eye, the sclera we know is white and not red, no signs of irritation. Last but not least, with the eye, I'm going to look at your retina and the optic disc. I'm going to feel the light come on, and I'll have you look again straight ahead to the flowers for me. I'm going to start about 2 feet away. See the red light reflex here? Visualizing the optic nerve. I visualize the optic disc and the cup in the middle, and noting the size of the cup. It is less than half of the diameter of the optic disc. AV ratio is about 2 to 4. No AV nicking noted. Let's do the other side here. Again, red reflex is present on the left eye. Optic disc is located with a cup size less than half the diameter of the optic disc. No AV nicking. And it looks like AV ratio is about 2 to 4. Moving on, we're looking at the ears. No redness or bumps, lumps noted, no signs of trauma. Palpating, the auricle, tragus, any tenderness,
No.
and palpating the mastoid process, any tenderness here, Bob?
No.
Wonderful. Looking more in the ear, there's no lesions, no external discharge. Be testing your hearing now using the whisper test. I'm going to stand about a few feet behind you. I'm going to whisper 3 numbers, and I want you to repeat that.
5, 3, 1. 2, 3, 4.
Awesome. No signs of hearing loss so far. Next, we'll demonstrate the patency and intact cranial nerve 8 using the Weber and Rhine test. I'm going to put this tuning fork that's vibrating on top of your head, and I want you to tell me if you hear it left, right, or both.
Both.
Wonderful. So no lateralization of hearing. Next test, I'm going to do the same thing, but it'll be right behind your ear. Tell me when you stop hearing that. And then I'll put it right next to you. And then I want you to tell me when you stop hearing that sound next to your ear.
Stop. Stop.
Good. Do the other side.
Stop. Stop.
Awesome. So air conduction is greater than bone conduction, which is a normal finding. Now we'll take a look in your ear. Use on the right side, I'm using my right hand, moving the auricle up and back as I gently insert the otoscope into the canal. I'm looking for any signs of swelling, redness, cerumen, and we are clear. I'm visualizing the tympanic membrane. We are pearly gray, no redness. The cone of light is visualized anterior and downward. Normal finding. Let's check the other side.